Hi, nice to see you. Would you mind introducing yourself before we start?
I'm Vera Paiva. I'm a psychologist by training, working with public health for a long time, and a professor of the University of São Paulo, Brazil.
And we've known each other a long time. We've worked together a long
Yes.
time, over many decades. If I can start with the personal and just ask you if you can tell us something about how COVID has affected you personally, you, the people in your life, just more generally, so that people have a sense of what's going on in just generally when we talk about work.
We got into quarantine very early on. I work with prevention, and I believe in science, as all my family. We had suspicions that we were exposed to COVID. My brother, who is a tetraplegic, but very active writer and activist, and just after Carnival, he felt he had a fever, he had some symptoms, right? And their kids after that had headaches, some fever. The kids are 6 and 4 now. He decided to be tested, and in fact he had been infected, and he was our main worry because he's the most individually vulnerable person to the disease. But he was okay. And then we began to try testing everybody because we were in a bubble. At the end, my son did, my oldest son did test positive. He's 31 and was active. So he was isolated in a piece of our house. And my husband had a positive EGA exam, which means that he was infected not so long ago. And I tested negative the whole time because I'm the female, and I think there is a gender issue. I think men have much more difficult at taking care of themselves and protect, and they do understand rationally, but it's difficult. But I was keeping distance with my, I was doing the right thing. I was not leaving the house and so on. So, and I'm negative for the whole time. In the research we are doing in Favela de Heliópolis, which took some time to get the virus there. Favela is a very poor neighborhood where people live because they occupied the territory. They go to a territory unoccupied and it becomes their territory. A lot of people in very, very small houses, very narrow streets, right, living together. The epidemic began with us, middle class, in some districts where people did travel, especially to Europe. Somehow it gets spread to the poor territories in the peripheries of the city, right? It's a very, very difficult situation. They have, like, I was talking to them last week, it's like every street in the favela has somebody who died.
Wow.
One family that was affected because of other things, because of the social economic situation. So they are much more vulnerable in other senses, like a lot of diabetes, a lot of other kinds of connections that expose people to more easily to have a worse COVID development, right? And they are afraid to go to the hospitals. The situation in Brazil is such a crazy one that health professions are being stigmatized. Right, literally, right? So people, there was one shop the other day that is owned by a fascist who supports Bolsonaro's government, who put on, they just opened some of the shops and they put how to say, cartaz, poster saying, please, if you are a health professional, do not enter my shop. Can you believe that? So it's stigma and discrimination is playing out.
You know, you talked about the communities that you work with. I just wondered, in terms of the communities that you work with, if you have any concerns, not just about the immediate, but kind of going forward.
They don't have access to food. And that's why they circulated in the city. The community-based organizations are very well organized. They are doing a wonderful, I'm quite proud of what we've done in 25 years of democracy. Like, they are organized. We could make a bridge between us, middle class, with information, with resources, and them. They did react, right? But it's very quick because they don't have a fixed job. Most of them leave. Most of them are Black people, right? 70% of them are Black people, and they have not access to structured job opportunities. The others never had a job. They need to go out to make a living, to sell small things, to do cleaning, to do, right? So that is the situation, the favela. It is, you cannot say stay home to these people. They can't,
Yeah, totally.
right?
So thank you for this. I really appreciate you taking the time. Okay.
Bye-bye.
Bye.